Bobby, that's fascinating research that you guys are doing. I'm interested in the thymus gland, kind of in this longevity field just as a hobby. It's always been kind of part of my life since I got out of college when I read the first life extension book put out by the Shaws. But I'm very fascinated by the study of peptides, especially certain peptides that are helping to regenerate the thymus gland, like thymosin alpha 1 or TB4, I guess, or TB500,
Hmm.
and epitalon, some of these other, and even to some extent melatonin. So I'm fed that we're just kind of at the cutting edge of some of this really great research.
Yeah, that's a great point. And sorry, I
My name is Brian.
Brian. Okay, great. Yeah, Brian, that's a great question and a great kind of observation. I mean, yeah, there are interesting kind of peptides out there. Like in the TRIIM protocol, you're probably already aware. You know, we use growth hormone, and we use a few other agents beyond that. You know, in concert with it. But there are other peptides out there, or there are other kind of agents out there that are pretty intriguing. And you mentioned thymosin alpha 1. Yeah, that certainly kind of qualifies. Epitalon, I agree. Melatonin, has, I mean, it's something people use all the time, right? But it does have very, very interesting properties. And just in general, there are different secretagogues out there that they kind of mimic or simulate the effects of growth hormone. One interesting part of that also is that some of those agents are much lower cost, than growth hormone. One downside, a bit of a downside with our treatment today is it's pretty expensive. Like the medications, the diagnostics, yeah, it's not, they're not, that inexpensive today. But some of these other kind of peptides or secretagogues may have similar effects, and they may be much more accessible, much kind of lower cost. But I think this also kind of gets at, we're really just kind of scratching the surface, in terms of what we can do. Like the initial TRIIM trial, was notable in that we show we were able to regenerate the immune system, and we had this first where we were able to reverse biological age, reverse epigenetic age by a few years in already very healthy older people. And that was kind of after many other agents, kind of these putative longevity drugs like metformin and rapamycin and others have been tested and nothing really worked. But the TRIIM cocktail, seemed to have a significant effect. But now, we're doing the TRIIM X trial. So that's a larger study, about 100-person trial where we're enrolling people from anywhere. We're based in Los Angeles, but we're able to enroll people from anywhere across the U.S. By kind of telemedicine. But we're aiming to kind of replicate the findings from TRIIM, where we're able to reverse epigenetic age significantly. But then we're also hoping to expand on that. We're hoping to kind of amplify those effects. I mean, I feel like we're really just kind of, yeah, just getting started. And maybe one example of that is like in the original TRIIM trial, when we saw this intriguing effect, and it's a 12-month treatment where, from months 9 to 12, there appeared to be a duration of the epigenetic age reversal, like in those last 3 months of treatment. So it really kind of begs the question, well, what if we go to 15 months, or what if we go to 18 months with treatment? Would we double the effects we saw in TRIIM? So questions like that are kind of what we're getting at with TRIIM-X, and we're certainly really excited to start kind of using additional compounds, in concert with it, and yeah, and just kind of, testing a variety of different approaches.
Were any of those compounds NAD plus or NAC or acetylcarnitine, or were they all kind of some kind of delivery drug or peptide?
We don't use NAD compounds. I mean, a lot of people are on kind of sirtuin activator or like an NMN or NR. People take that kind of at the same time as being on treatment. But no, they're not like a core part of the TRIIM protocol. Yeah, yeah.
Yeah, you mentioned the security guards, which are amazing, and the cost and how effective they are, like ipamorelin, um, uh, or GHRPs. Some of these, or the MOD 129s, or the CJC 1295s. These things can be very powerful together at a quarter of the cost and less side effects.
I agree that they're interesting. And like the cost. Yeah, I mean, I don't. I think the efficacy is the uncertainty, though, right? Like I don't think
Yes.
that and I mean that's an important part of it. Like maybe but maybe the most important part. So but I do agree that they're really kind of intriguing compounds, and it's great that there are agents like that out there that yeah, I mean they may rival some of the same efficacy, but I mean they're pretty unproven today. But yeah, just the fact that they're out there and they're available at lower cost, it's exciting, and hopefully over the next kind of 3 to 5 years, we'll really have some answers as to what how effectively those agents can be used too.